Hey, Dr. Joe here. Today what we're going to talk about is sciatica. And what is sciatica? Sciatica is a nerve, and irritation of that nerve, simple, gives you a diagnosis of sciatica. So if you just have low back pain, if you just have buttocks pain, it could be a component of sciatica, but it's not real true sciatica symptom. Sciatic nerve runs down the back of the leg, goes to the back of the leg to the bottom of the foot. There's multiple nerve roots coming from the low back into the pelvis that join together and form this large nerve, which is why treating the low back if you have sciatica is crucial, because that's where it usually stems from, the nerve itself. So what do? How do you treat it? Well, it all depends on the diagnosis. So just simply lying on the back, doing some stretches is not really that great. And I'll be honest with you, because you don't really know what's really causing your sciatic issue. Is it a bone? Is it a joint? Is it a disc? Is it inflammation? Muscle? Is it another pathology like a cancerous tumor putting pressure on it? You don't know. How can you find out? You go see your family doctor, you get some imaging done, x-ray, ultrasound, MRI, whatever you need to do to figure things out. You go see a therapist like myself, any other rehab professional who will do orthopedic tests, functional tests to determine what the main cause could be. And then they would devise a treatment plan towards that. So these do-it-yourself videos are great, and I'm a big proponent of do-it-yourself. However, you gotta have a diagnosis first. You gotta find out what's causing the problem. Don't just do whatever you feel, because you might make the problem worse, especially if there is inflammation, or especially if there is a disc herniation, because lying on your back, pulling your knees to your chest, or doing some rotation of the spine may aggravate that disc and put more pressure onto that sciatic nerve. So what does sciatica really feel like? Sciatica gives you burning, numbing, tingling pain. So just a general weakness down that leg, where you feel like you have to always shake it or stretch or rub the leg, rub the glute in order to relieve the stress. That's typical pain, and it most commonly runs down the whole leg. All right, if it just stops here or over here into the low back, as mentioned, it could be a component of it, but true sciatica is that. During the treatment process, you might have also changes. Your symptoms may start progressing, where no longer the calf or the foot is numb, and now just the back of the hamstring, and then to the back of the glute, and then just in the low back. That's great. That means it's called centralization. You're centralizing the pain to the problem spot, and you're not just getting referral down to the whole leg. All right, so be very wary. Don't just do it yourself. Get a proper diagnosis. Get treated by a proper professional who can handle these cases, because sciatica can be caused by numerous things. Get the diagnosis, figure out what's happening, get treated. Thanks guys, this is Dr. Joe. Take care.